What does it mean to be a public health practitioner? Public health professionals work in a variety of settings, from government to academic spaces, doing health education, research, program planning and evaluation, grant management, infection prevention, data analysis, and much more. In this video, we'll discuss 5 traditional public health careers and explain their job roles. But first, something that I learned in my public health career that is not really intuitive is that a lot of public health roles may have different names, but you could be doing similar activities. For example, today I'll highlight the role of an environmental health scientist, but when you're searching for jobs, don't be surprised if this role also pops up as natural resource specialist, environmental health researcher, environmental health specialist, or some other similar term. A lot of the times, the job descriptions of these roles will be most helpful in determining if you think it's a good fit for you, because many public health roles share the same technical skills, such as data collection, data analysis, stakeholder collaboration, etc. First up, we have an epidemiologist. Sometimes you'll see this job presented as a data analyst or even biostatistician. I'll make a future video on this, but even though there's a lot of overlap between biostatistics and epidemiology, the two are slightly different, but both work in data analysis. And if that's something you're interested in, be on the lookout for these graduate programs or jobs that have biostatistics. Epidemiologists are public health workers who investigate patterns and causes of disease and injury. They're going to be involved in data analysis, working with large data sets, doing surveillance, which is essentially just ongoing data collection and monitoring to track disease rates. So most of the time, you'll be working with numbers or quantitative data. Here's an example of a map that an epidemiologist probably made looking at breast cancer screening rates in Rhode Island. I absolutely love that they use different shades of pink to show where the higher rates of screening are. Sometimes maps are called data products or data visualizations in more technical public health terms, because this map is that final result of your data analysis that you can show stakeholders, whether it be the public, funders, or higher leadership in your organization. It's translating all those numbers and showing trends in a format that's easy to understand. Next up, we have a program evaluator, which is what I currently do right now. Program evaluators collect and analyze data to determine whether a program is achieving its goals, identify areas for improvement, and provide actionable recommendations for stakeholders. Program evaluators are also going to be involved in data analysis, but they typically work with smaller data sets, capturing program or activity metrics, known as performance measures, and also use qualitative data in their reporting. The difference between an epidemiologist and program evaluator is that an epi typically works with larger data sets, such as regional or national level data. Program evaluators work with smaller data sets that are typically program data. Here's an example of a public health program. Let's say your organization or partner organization is starting exercise classes for older adults with the goal of improving overall physical and mental well-being. As a program evaluator, your role is to help the program staff determine how effective this program is working, and in doing so, you want to create those performance measures to track data over time. In the short term, you may start with collecting the number of people who register for the classes, the actual number of attendees or people who show up to the class, and the number of classes held. Now, over time, you'd be able to compare these numbers and maybe you start noticing a trend. For example, numbers are going up over time, or over multiple years of the project, you notice that the numbers are higher during certain seasons. If you had these classes running in multiple locations, you could analyze which locations tend to have more attendees. Further into the project, you can capture more data. And one tool that public health program evaluators and researchers love to use are surveys, because you can capture a lot of information and it's both low cost, many times free since people can take it on their phones or laptops, and it's not as time consuming. In the long term, you can capture more qualitative data by interviewing participants one-on-one or through focus groups. And once a program evaluator starts capturing this data, they can present it to the program staff and organization, as well as other stakeholders. We even use data visualizations too, so charts, figures, and graphs to present the data. Next up, we have a health educator, sometimes called health education specialists or program specialists. Health educators are public health professionals who help individuals and communities develop healthy lifestyles by teaching them about wellness and disease prevention. Health educators serve as a resource guide in that they share a wealth of public health knowledge. They could be certified registered dietitians, physical activity trainers, community health workers, or other trained professionals with a goal of educating individuals and communities on healthy lifestyles, behaviors, and the risks associated with unhealthy choices. In doing so, they are increasing health literacy among the community so that people will have increased knowledge on healthy habits and where to look for credible health information. By educating the public, health educators are on the front lines of community health and tend to be involved in community outreach programs. Some health educators may be a part of a certain program or initiative which has set goals and grant requirements, so they also serve a key role in program implementation. A health educator may discuss healthy eating habits with elementary students, mental health with college students, and physical activity with older adults. A key part of their role is understanding who their audience is and tailoring their messages and activities to the population. Now on to the next career, an environmental health scientist. Environmental health scientists protect public health by ensuring a safe environment through education, inspection, and enforcement of regulations. As an environmental health scientist, you may be working in the field, collecting water samples or other environmental samples, or you could work on the reporting side where you analyze the data of those environmental samples that have been sent to laboratories and then over to your organization. If you work for a government agency or other organization, you may be monitoring data in order to ensure that samples are following regulations. I used to work at my state's environmental health agency where we would ensure that public water systems' water samples are clean and follow regulations. We would work with local cities and towns, and they would take samples of their drinking water, send it over to the laboratory, and then we would get the results and reports from both the water systems and the lab. We'd then file these reports when they got sent to us, enter in the data, contact the public water systems if we needed more information, and create reports from the information that we collected, as well as present data to our team and stakeholders. Next up, we have a research coordinator, sometimes called a project manager or project coordinator. Research coordinators manage and support public health research studies, which includes recruiting participants, collecting and managing data, and ensuring compliance with regulations and protocols. A research coordinator oversees one or multiple projects, collaborates with staff, upper management, and other partners, and may be involved in grant management or taking care of the funds for that project. They also ensure that their project is approved by institutional review boards. These are organizations who ensure that research is ethical and just. A research coordinator typically works with multiple staff and partners. They're reporting to upper leadership, so if you're working in an academic setting, you may report to the principal investigator or the professor in charge of a research project. That principal investigator may also suggest to hire additional staff, such as research assistants, to the team. Again, if you're at an academic institution, research assistants may also be students. Research coordinators and their team often work with other partners, whether they are the study participants or contractors of the research project. They also collaborate and report to funders and the internal review board staff. That was our overview of 5 different public health careers, and here are 5 others. Leave a comment if you want to learn more about a specific career or have questions about other public health topics. Thanks for watching.